Welcome back to Let's Get Personal. I'm your host, attorney Chris DiBella. As a reminder, before we get started, be sure to like and subscribe to us if you haven't already done so. And don't forget to tell your friends about us, as it's the best way for people to learn about the pod. Today's guest is Dr. Deborah Fudge, a chiropractor with 37 years experience and a unique perspective on helping people. So let's dive right in.
Well, we're so happy to be joined by Dr. Deborah Fudge,
Thank you.
chiropractor. And I'm really excited to get into this episode because, I've done a lot of podcasts and they don't always overlap with what I do for a living. And a lot of my clients have a lot of exposure to your industry. And I think there's a lot that can be learned from some of my clients about the benefits that you can gain from going to a chiropractor, maybe debunk some of the common myths that people have out there about them. But, why don't we jump right in? Tell us, how did you get into the chiropractic world?
Well, that's probably my favorite story. And it just so happens, as I said to you earlier, yesterday was my mom's, it would have been her 89th birthday. So it's been, I think, not just a coincidence that I'm here today speaking from the heart about what chiropractic can do, especially for someone who has been in a car accident. That's how I got started. My mom was rear-ended. When I was a junior in high school, she was rear-ended by a drunk driver. He was going 80 miles an hour. From that point on, she was never the same. So she developed low back pain right away, neck pain, but then started getting pain down the legs, sciatic pain, losing feeling. It was just from bad to worse. So the traditional route back then was medication, rest, maybe PT, sometimes was hospitalization. Never once did anyone mention a chiropractor to her. If anything, it was, oh, don't go. So there was still a lot of, demystifying. I had no idea what a chiropractor was, never heard the word before. So this all went on for 4 years. So as the oldest of 4 kids, my dad was working 2 jobs. I was trying to do what I could do at the house to pitch in the best I could, but I felt in a way like I was drowning too. So when mom isn't doing well, it has a trickle-down effect on the whole family. Very frustrating to watch someone you love be in chronic pain and not be the same person who they were before the accident. So it got to a point where pretty much medicine kind of gave up on her and told her there was really nothing left to do. She was not a surgical candidate. So it kind of left her in limbo. It wasn't until she went to a health fair and a chiropractor was just giving a little talk about low back pain and sciatica. And it was the first time for her to say, wow, it's the one thing I haven't tried. And so she didn't get anyone's permission. She just looked at a newspaper, found an ad from a chiropractor that was fairly local, made an appointment, and she started going. And I was away at college at the time, didn't really know what I wanted to be yet. And I called home to see how things were going, and she said, I've never been better. And I said, whoa, wow, Mom, what's going on? She said, well, I started going to a chiropractor. And I literally was like, what's that? I said, but whatever it is, I want to go and see what is this person doing that's very different from all the other things that you've tried. So during break, I did go with her. I'll never forget, he was so patient. He went over her whole situation with me, explained it so that I could understand because I had no background in this. And it was a huge aha moment for me because it answered some questions that we've been struggling with, like why isn't anyone able to get to the bottom of this low back and sciatic pain? And I just want my mom back, and you're doing this for me. I always was fascinated with the human body, but I also was too queasy to become a surgeon or even a nurse. Medications work, I was a little bit gun shy about treating people that way. So this answered a lot of things for me that I didn't even realize was a profession. Right. From that point on, it was just lights out, just show me how to get there.
Well, I bet you a lot of kids, my daughter's in college now too, and having that aha moment where this is a passion,
yes,
this is something you want to do is great to have.
It was a great feeling, and seeing the impact it had on my mom, I knew that I was now in a position to do that for others, and I was hoping to cut that time by years, right, that they can now start to get on with their life.
Now, for the people that might be listening out there, a lot of them, I had some exposure to chiropractic care myself when I was younger, but for a lot of people that don't know what a chiropractor does, hasn't been to one, how can you break that down in layman terms for them?
That's the question I get every day. I think now also with social media, people are learning at a faster rate too. So they're going online, they're finding videos, they're watching things, they're learning on their own. But to break it down, a chiropractor focuses on the spine. We influence the alignment of the spine and how that relates to the entire nervous system. So we use our hands quite a bit to palpate or feel the spine, feel how things are moving. And when there is misalignment, there is restriction in a joint, and we use a very, very controlled amount of force to make an adjustment to that particular area that we call a subluxation. It's kind of a fancy term in chiropractic, meaning a misalignment that has some nerve interference.
So, it's one of the things that I think people can relate to, or they think about twisting their own back and hearing it crack or cracking their knuckles. What is that noise?
The noise, it's funny you're saying that, because when I first started, if someone said the word crack,
It's a misnomer.
Yeah, it's a
right?
misnomer. And it would bother me because I knew I wasn't breaking bones.
Right.
But it's basically a release of gas within the joint. The vacuum changes when we make an adjustment. But it does have a kind of a crack sound to it. And I would try to educate people and use the term that you got an adjustment. I'm not cracking you.
Right.
But now with TikTok, YouTube, people are fascinated with the crack.
Right.
And to them, they're not scared because they know it doesn't mean that anyone's getting broken.
Right.
So it's kind of flipped a little bit. And as long as they're learning about chiropractic, if they want to call it a crack, that's fine.
I mean, it's interesting because I think people, they associate, and I've been on the table and you get these adjustments, but when you're actually the patient,
Yeah.
and there's, everybody kind of gets a little relief when they twist their back or stretch it in different ways. But when you're isolating a particular area and it's much more pinpointed towards some distress in that area, the relief is different.
Yes, it's like someone took the nail out of your foot. It's like, oh, that's it. Like that, you got it. Yeah. I mean, anyone can make a lot of noise. You can move around and things are going to pop. That's very different.
Especially the older you get.
Yes. Yes, that's so true.
Right. So what types of injury symptoms do you commonly see or treat regularly?
So I would say for chiropractors, musculoskeletal is still going to be like the thing that everyone knows about. Neck pain, headaches, pain down the arm, numbness and tingling, low back pain, sciatic pain. Those are, probably the top conditions that we see. Many times after, let's say, a whiplash injury, where especially if someone did not anticipate the accident, they would just you would think that being relaxed would be helpful. It's actually not, because now the muscles aren't able to contract and prevent the excessive amount of motion. So we definitely see injuries from accidents, but we also treat everything from infants. Yeah, I know infants, and people will say, what are you doing with an infant? How do you adjust a baby? And why would a baby need a chiropractor? So these are the things that I think a lot of people haven't learned quite yet, is that, yes, we do work on babies. And one of the top reasons for that would be a colicky baby, a baby that's having difficulty turning their head, so they're having difficulty latching, and even constipation. Because what we do with working on areas of the spine is going to influence the neurological input to the various areas. So I'm calling myself the baby whisperer lately because I'm getting a lot of referrals from a lactation specialist who is seeing babies not able to latch properly, which is making an impact with the whole feeding system and everything. So people are becoming, I think, a lot more aware that there can be a safe way to work on an infant.
Right.
It's very different than working on you.
Right.
Yeah.
Well, it's interesting because I think a lot of people just associate chiropractic care with, misalignments and getting it back into line. But to me, I think from what I'm hearing, what I know about it, it's also the complexity of the spine and the nervous system that it has implications throughout the whole body.
Yes.
So you're talking about being colicky or constipation. That misalignment could be affecting nerves that impact that procedure. Right? And
Absolutely.
I think people also just think about my spine's out of whack.
Exactly. So there's a lot of different ways we can all approach our health, and from what I'm seeing, the older we get, the more value we put on health, because we know this is it. We got one body, and how you treat it is going to be very, very important with what the later years look like.
Right.
So we get the opportunity to educate, and then the patient decides how they want to do it. So I have zero judgment. I have some, I'll say guys, just to just to kind of make a point. There's a lot of guys that will, they wait till they're a disaster.
Right.
They come limping in. They're just like, doc, fix me. So, and usually they can get better. And then a lot of times they're on this sort of cycle until they hit a certain age. And then they're like, that maintenance care that you talked about, I think that would be a smart move for me. But I just educate. I can't make anyone do anything. I just want them to live a life that doesn't have to be like that. They don't have to be a disaster every year.
So that brings me to a good question I think that you raised, is that once you get adjusted, is that's not the end of the care? So there's some level of maintenance, or is there certain instances where it is the end and it's very, maybe it's a short treatment window, and others maybe because they're engaging in a routine behavior, they have a very sedentary lifestyle, or that they're not removing what's really creating it, so they need to continue to do it longer, or how does that?
I would say yes to all the above. Yeah. So every person is unique in how they are approached. And so there are people that take really great care of themselves. So they work out, they eat right, they work on their core strength, they have a good mindset, they're not under a lot of stress. That's not always the typical norm. So depending on lifestyle, job, previous injuries, there's patterns that will come back. The body always wants to go back to what it knows, is what we call homeostasis. So even if it's something where they're totally out of alignment and you're it's wrong, but it's been a pattern that's been set up. So undoing the pattern may take longer for one person than another. And similar to dentistry, getting your teeth checked, you're not waiting for your teeth to hurt. You're not brushing your teeth in between cleanings. You're doing some form of maintenance. I look at chiropractic that way, is that for everyone, that maintenance care is going to look different. For some, it might be a once-a-month checkup. For others, it could be once a week, depending on what they've been through.
Right. So you raised a baby that's colicky or constipated. For me, some of the more obvious things, because it's my profession, is the people that have been in these car crashes. There's a lot of soft tissue issues. What symptoms would people have that they really should go to see you, so that maybe there's things that we're not even thinking of, or the average person's not?
Great question. Related back to a car accident?
Yep.
Okay, so it could be that headaches continue to persist, and there's a lot of different causes for headaches. So I'm not going to say it's only related to the spine, but if other things have been eliminated, a lot of times, very much it is. Right. I think concussions, where the concussion has been the focus as far as brain injury and ruling that out, once that's been ruled out, many times I'm seeing patients post-auto accident that never had chiropractic care, is that the neck pain and the headaches, but in particular, will persist. Right. And a lot of focus has been the brain, which understandably. Right. But you really can't have a concussion without a whiplash injury too. And I think that many times gets lost.
Right.
Yeah. So, periodic headaches, numbness and tingling down the arm, low back pain. These would be some things to say, maybe I do need to have regular checkups. Right.
And if somebody's interested in seeing you or any chiropractor, what's a first visit look like?
First visit, well, first of all, there's a relationship building. Right. And I know that even if someone's excited to come in, they're also a little nervous, just like I'm a little nervous. This is my first podcast. So if you've never been to a chiropractor, there is a little sense of fear. I think that's kind of natural for anything that's new. It always starts with a very detailed consultation. And so I'll be asking a lot of questions. We have an online intake that patients will do before they come in to see me. And I will have already reviewed all that. So I'm already formulating an idea of what's going on and things I need to investigate a little bit further. Inevitably, there are things that people leave out because I just don't think it's important. And I'll dig a little bit and say, well, what other things have you been through? Oh yeah, that's right. I did fall out of a tree one time, and when I was a kid, and I broke my leg, or I fractured a rib, or I had a sports injury and I was out for X amount of time, or I had another car accident, but it didn't seem like anything bad happened. So many times there's multiple things as we live our lives that we're going to have injuries, and I think it's important to delve in a little bit deeper to find out what they think could be normal is probably not normal. Then that leads to an examination where we palpate, we do ranges of motion, I run neurological, orthopedic checks. Many times from that, we are already formulating our diagnosis. And if x-rays are needed, they'll be sent out for x-rays.
Okay. And then you develop kind of a treatment plan from there?
Yes.
Depending on how they present?
Yes. So I go over everything before I even make any kind of adjustment. First of all, I'm going to be getting consent from them. And I will be laying out a treatment plan for them, and we'll work with them the best we can. I'm in the office from Tuesday to Saturday morning, so there's quite a bit of flexibility in terms of coming in for care, and I'm happy to work with them any which way I can.
Right. Now, kind of debunking, you kind of got to it early on, but I think it's important because between having gone when I was younger and also just a lot of my clients end up going to chiropractic care, so we're just very familiar with it. It's always been around in my world. But, looking, doing some research for the podcast, some of the common misconceptions or myths that they have related to this. One, which I think you touched on, is that I think a lot of people think it hurts.
Yeah.
And some of the, adjustments even look like they might. But can you talk a little bit about that?
Okay, that's a great question. Sometimes, if you were an outsider looking in with some of the moves that we would do, it does look like, oh wow, there's a lot going on. It's a very controlled move, however. Some of the things on TikTok, for instance, I was never taught some of these techniques.
Some of them are pretty wild online.
They look aggressive.
Right.
So I can't necessarily sanction something that I don't do or I wasn't taught how to do. That would not be the type of force that I'm using. So if someone is looking for that, towel yanking and
I see some of that.
I just think it's way too much force, in my opinion.
Right.
I don't think it's necessary to go that degree. Things take time. You're not gonna be able to fix everything in one visit, and
Right.
I think that may be some of the appeal to these more aggressive types of treatment, that we're going to do so much in one visit, but how much can the body, can it handle all that at once? So it could be that it's very uncomfortable after.
Well, and you're also kind of training it to go back into that position, which naturally probably doesn't want to do until you're doing several adjustments.
Yeah,
over
usually
time.
it usually and it's similar to going to a gym. You wouldn't just pop in for one visit and say, okay, I'm in great shape now. You're going to need to go repetitively, and then you're going to start to see muscle build. You're going to start to feel better ranges of motion. Similar to chiropractic is that over a course of a treatment plan, whatever that looks like for the individual, then we readjust, then we reassess, and we determine what will be the next. What does the next phase look like? So it is different. It is different for everyone.
Right. And another big one that I got that I didn't even really know was really a big one. I don't know if you hear this much, but there's this thing online that you're not real doctors, right? And I know that you guys go through a great amount of education to get to where you're at.
Yes.
Can you talk about where you have to get to become a licensed chiropractor?
That's a great.
Is that something you run against at all? Or?
Not so much now, but when I when I first discovered what I wanted to be, and I'll never forget, I was at a Thanksgiving party type of thing, and I was so excited about, like, I'm going to chiropractic school, and and someone said to me, "Why don't you become a real doctor?" And it was my first introduction to some form of prejudice about chiropractic, because it had made such an impact on my family. I wasn't aware at that age that there was all this other stuff going on, that people didn't consider us to be a real doctor. We're not pretending to be a medical doctor. Right. We are a licensed chiropractor. It's a separate and distinct profession. We do need to, it's a 4-year doctor of chiropractic degree. Prior to that, it's almost 4 years to get in. When I was applying, it was 72 credit hours. So most people didn't know right out of the gate what they wanted, so a lot of them went into school with a bachelor's already. I discovered chiropractic when I was 19, so I had some undergraduate, but I still needed all the core sciences: biology, chemistry, organic chem, which just about killed me, physics, and then the 4-year chiropractic degree. And we have national boards to complete. We have state boards to take. We have yearly relicensing every year, 12 credit hours. So it has definitely changed a lot over the years. And, there'll probably always be some form of ignorance out there, but, with education such as this, I'm hoping to demystify, debunk some of that.
Well, I think there's also anything related to something that I would classify as more holistic, right? Where you're not talking about cutting and prescribing.
Right.
How do we get the body to heal itself? What are, and it could be anything from, acupuncture and massage therapy and a lot of things that I know a lot of people that do all of these things. And I think this is another tool in the toolbox, like you said, where a lot of people are not getting the outcomes they want from maybe more traditional pathways.
Right.
That I think it's something that they should be educated that this is an option.
I couldn't agree more. I think the opioid epidemic fiasco really opened people's eyes to think about what you're putting into the body, even if a doctor recommended it. Because as we know now, looking back, the 2 things that people were told when they were prescribed an opioid, number 1, that it was non-addictive, because the doctors were told that.
Right.
Number 2, that it was long-lasting. Again, another false statement. Right. Those were 2 of the biggest false statements that doctors and patients, I think, and that I've seen in my lifetime, that completely turned normal people into addicts. Right. Buying heroin in Lawrence, on the street, grandmothers that were highly educated.
It created this dependency on
yes.
this drug, and you had to continue to up your doses just to get the same effect, and yes. just like any other drug. And I think it is, and we see a lot of that in the legal profession. Yeah. Obviously, a lot has happened. Yes. The attorney generals of many states have gotten involved in trying to recover, but unfortunately, there was a lot of people that were victimized, and families that were disrupted and broken up as a result of it. You're right.
I remember hearing at the beginning of all this some stories from patients, thankfully, who were able to get off of it, who were telling me their story, and it was always that they were going for help for pain. They had a knee injury, they had a back injury, they had a neck injury. They never, ever dreamed that they would become addicted to that substance. It never crossed their mind. I'm sure it never crossed the doctor's mind. Right. But it was such a slippery slope that by the time we caught up to all that, there was so many people that had passed, so many people that were addicted. It was a terrible situation. It still is. I think patients started to see that just putting something in their mouth to handle pain was not actually treating a problem, but it was certainly taking the pain away until it wore off. Right. And now it's back again. So we like to look at things more of like, what's causing the problem? And a lot of times it's something that I can help. And then there's a lot of things that happen that I have to refer someone out. And, with building relationships over the years, I do keep a list of who I consider the best of the best. And I'm happy to be able to say, look, if this isn't getting better, I'm going to refer you to this person. That's their specialty. And I know patients really appreciate that honesty, that I'm not pretending to know everything or that I can fix everything. Chiropractic's going to have limitations. The body's going to have limitations. But when we reach that, what do?
Right.
We don't just pretend it doesn't exist. We're like, well, let's get to the bottom of what's causing that.
So that's what one of my next questions was going to be. How do you integrate with the other medical providers that are out there? And it sounds like, and I don't know if you're speaking particularly about orthopedics and other pathways out there, but when you talk about referring out and keeping a list, it sounds like you have an understanding of, hey, we've tried this, now this may not be getting you what you need, so you might have other recommendations for them. But how do you integrate with these other fields?
That's a great question. So, for instance, let's just take a knee injury,
Right.
And they're weak. The knee is unstable. They feel like they're going to collapse. No one's really done an MRI yet. So the first thing I would recommend is let's get an MRI. Let's see what's going on with the soft tissue. Mm. And if there is, like an ACL tear, a medial lateral cartilage tear, a meniscus tear, something outside of my scope of practice, I'm going to want them to see an orthopedic surgeon to evaluate that. They may start with a conservative approach, or they might say, look, it's too far gone. Surgery may be the only option for you. I do think people are people, whether they're a chiropractor, an attorney, orthopedic surgeon, neurological expert, PCP. I mean, we're all human. And hopefully we're all looking to do the best we can for our patient. And so I will align myself with others who I have learned over time are the same way.
Right.
And I'm not going to say that's true for everyone out there, but the people that I'm referring to, I have already checked out. I've had conversations with them. I've referred other people to them. I know, like, and trust them.
Right. Well, it's funny because I feel the same way. Mm-hmm. We have a network of people that we refer things out or that we rely on for different narratives or expertise. And, we pride ourselves in providing a certain level of care for our clients. And we also want them to experience that with the people we refer them out to. So we take a lot of pride in finding and making sure that people we're referring them to, are of the same nature and quality. So it sounds like that's how you approach it.
I learned that the hard way when I first started in practice. And again, very naive, because our experience with my family and chiropractic was that this was a miracle for my mom. So I just thought everyone loved what we do.
Right.
And my first experience with referring someone out, I was new, so I didn't know anyone yet. So I said, well, I've heard of this name. I'm going to refer this patient. I suspected they had a fractured hand. And when I called to make an appointment and introduce myself, they asked what kind of doctor I was, because they hadn't heard of me, because I was brand new. And she put me on hold and came back and told me, well, the doctor doesn't accept patients from chiropractors. And I was so stunned. I was like why?
Right.
We're not just, we have a licensed degree. It's not like we're just pretending to do what we do. We've had to go through a lot of hoops. Anyway, it was my first introduction to, not everyone's going to be so happy, about a chiropractor.
Right.
Or to have any interaction. But that was then, and this is now. And I do think we've come a long way. And people, a neurologist knows that not everyone's going to be a surgical candidate. Same with an orthopedist, that if we can do something in between and work together, we're looking out for the best for the patient.
Well, so much, and we're both parents and both have our own business, and so much over the years I've found that, unfortunately, certain professions see, they're the hammer and that's a nail and that's all they see.
Right.
Yeah. And I think the professional that can see the whole scope and actually identify when it's something that maybe is not. And, because too many people are just worried about, well, let's just see what can I do to help. but is that the best mode of treatment for that person?
Right.
And I think to your point, that's not always the way people are handled.
Right.
But one of the things that you did hit on earlier was, some people work out, some people work on their core. What are some of the lifestyle changes or recommendations that you may make so that people don't, or being proactive about their spine and keeping it healthy?
So I like to meet people where they are. So you're not going to ask someone who has 100 pounds to lose to do the same thing that someone who's already an athlete. So it's going to be very, very different.
Right.
A big fan of starting off with just making one change and not to overwhelm anyone, because once someone's overwhelmed, they stop everything. Just had a conversation literally just yesterday with someone about drinking water. Now it sounds like, well, everyone knows we should drink water, but do we all know really how much we should be drinking? And there's debate on this, but a good rule of thumb would be take your weight, cut it in half, and try to aim for that for ounces per day.
Right.
This particular patient had long history of gout problems. And my first question was, well, how much water are you drinking? I said, well, I'm not that good about that. I said, well, we're going to start with, I'm not treating your gout, but the impact of being permanently dehydrated is having an impact on every function in your body.
Right.
So including all your discs, everything. So let's start with, if you just drink one bottle, let's just try to up it to 2. Now we're still very dehydrated,
right,
but I can't say to him, go from 16 ounces to 120.
Right.
I want him to inch his way up. So he gains some success with that. And same thing with exercise. If someone is like, let's just say they call themselves, well, I'm just a couch potato, I never move. And it's like, okay, well, motion is lotion. So whether you like it or not,
I like that.
you're going to need to move your body, and if your job requires you to sit a lot, your body says, I don't care. You still have to move me. So let's try to find some strategies that are going to work. And it could be something as simple as at lunch, just take a 10-minute walk. Let's just start simple. You're not running a marathon. We're just get up and move.
Right.
Or if you have the ability to have a standing desk, I'd prefer someone use that than to be sitting 8 hours. Eating is definitely a big part of our health. So we talk a little bit about that too. Sometimes it's not that I'm counseling, but I'm just giving suggestions to say, if you are already inflamed and you're eating a lot of junk, and you've already told me you're eating a lot of junk, those foods are going to also create more inflammation within your body. So you're not helping the situation right now.
Right.
And they're like, oh, I never knew that. I didn't know what I ate had an impact on inflammation. I'm like, 100% has an impact. So sometimes it's opening people's eyes to things they just never learned before, or no one talked with them about any of these things. So those are some examples.
How do you feel the digital revolution, so to speak, has impacted? I mean, everyone's on their phones all the time, their heads cranked, everyone's sitting at desks all the time. And a lot of people are working from home, so they're moving probably even less.
Right, right.
Have you seen any impact of that?
Yeah, sadly I have. I mean, the things that we would have seen with like an 80-year-old, we're sometimes seeing with a teenager.
Wow.
Because they have, this has been normal.
Yeah.
They're digital natives, as my daughter would say, And I'm not saying to not ever be on a phone or to use a device, or if your job requires you to sit, I'm not saying to not do that. But what we have to remember is we have the force of gravity already pushing down on us to keep us stable. And if we are not upright, and if we're bent forward already looking down, we're putting our spine, especially our neck, into a position where now gravity is going to have more of an impact, pressing down, and it's going to be harder and harder for that person to actually keep their head up. So they're training it to actually go the opposite direction. So if I'm treating, especially if I'm treating young kids, and they're on there, of course they have their phone. And it's like, okay, so if you're going to be on your phone, this is how I want you to hold it. And I said, unless you want to look like an old person at your age. If you want to look like this, then you keep doing what you're doing.
Right.
And the next time they come in, if they're holding something, they're like this. And their mom's like, I've been telling them this for years. And I'm like, yeah, but I'm not you. Right. Just like if I was to tell my kid to do something,
right.
They would be like, oh, okay, Mom, okay. And then you come along, you're like, hey, have you tried doing it this way? Oh, no, he's a genius. He told me how to hold my phone so I don't look like an old person later in life. So a lot of it comes down to habits, and how do you do things so that you're not killing your neck or your back. So,
and what impact, if any, does like having, I know one thing I heard all the time from my parents growing up was about your posture, about, getting your shoulders back. And is that important? Does it play a role?
It is important. It is important. Again, it's like training muscles. So, shoulders back, head looking straight. It all kind of makes sense when you think about it, but it's just convenient to just kind of slouch.
Right.
Again, with the tablets or the phones, to have the head down. It takes a little bit more work to hold yourself upright, to hold the phone in front of your eyes if you're reading a book, whatever it may be. But it is important because, again, you don't want to train the body to now go into this configuration where it's just becoming hunched over.
Right.
That will create more wear and tear on the joints. It's not an overnight thing, but with time, you can start to see more degeneration. No, and once that starts, you're not undoing arthritic changes. Right. You're just now managing them. So we want to try to do what we can to maximize this body of ours to live the most healthy, pain-free life that we can.
You might have just answered it there, but one of the questions I had was, what is one thing that you wish more people knew about spinal health? And it might be kind of the interaction with the rest of the body that it has and all that. But is there anything that comes to mind that people don't know?
I mean, there's an expression, we say the power that made the body heals the body. So that we are born with this ability, incredible innate ability to heal. And it's all designed within us. Sometimes things get a little bit off kilter, and we need some additional assistance on that. And that's where I think a chiropractor can be very, very helpful. The big misconception is you have to have pain to see a chiropractor. I don't agree with that at all. I'm seeing more and more parents who are already patients who now are getting the big picture that, oh yeah, my kids are involved with sports. They have injuries, they have falls, they have all kinds of things. I would like them to get checked out before they run into some chronic issues.
Right.
So I love seeing that.
And have you seen any? So how long have you been doing the chiropractic work?
For a very long time.
so you must have seen even
37 years.
37 years, right? So I'm sure there has been new developments. Is there anything that you see changing on the horizon or recently changed related to the care?
Yeah, we are definitely seeing more education in terms of going into specialties in chiropractic, which would be some neurological specialties, right, orthopedic specialties, concussion. I know there's a chiropractor, Ted Carrick, down in Florida, who has a whole clinic, really a brain-based chiropractic approach. So it's not just adjustments, but it's how to recalibrate the nervous system, how to recalibrate the brain. It's very unique in our field, and it's exciting. There's a lot of work now with how does the adjustment help with what we call vagal nerve stimulation, which is a cranial nerve, and it really kind of empowers the whole body to have a calming effect, such as with blood pressure, heart rate, respiration, everything that needs what we call a parasympathetic response, meaning like to slow the body down where we're in a very stress-related environment in life. We need things in a natural way to kind of bring that down. And one of the ways is through certain areas of the spine, making adjustments to that area, which can help facilitate that.
Right. And so one thing I wanted to close with that I thought was an interesting question, and could be from your experience, could be from your experience that you've heard through other colleagues in the industry, but what's been like the most dramatic impact that chiropractic care has had on somebody. And so you started off by talking about the baby, which I still think is fascinating. That the colicky and the constipation can be related to something that can be fixed. But what have you seen or heard of where it was the most dramatic change that somebody's experienced?
I still think my mom is always going to be.
That's a big one.
That's all. That is like, when I drive to work.
That's a real life.
It is so powerful to me, like how the impact of one person in a family, how that it's a big impact. My dad, the 4 kids, everything in our world was impacted by her inability to be able to be the person she was prior. But then I was also fortunate to see her coming back. So I got to see pre, during, and post, which was very powerful to say. But another great example, I didn't bring up ear infections. It's not that we're treating.
Right.
We're not saying we're treating the ear infection, but what we are treating is when, especially if there's an upper cervical issue with, let's say, a toddler, the fluid from the ear is not going to drain the same way it should. So now we've got to back up. Now there's pressure on the eardrum. Now fluid that's sitting around can get infected. And now we're seeing like kids that are on this chronic antibiotic throughout the entire winter. The second they come off it, back the ear infection. There was a patient who referred his granddaughter, and she hadn't been off an antibiotic for it seemed like 2 years. Every time she did, that same thing happened. And it was frustrating. I mean, everyone was frustrated. The parents, the kid, the pediatrician, everyone was like, what do we do with this kid? And they've tried tubes, the whole bit. And it was the grandfather who was a patient who said, what do you think about bringing in my granddaughter? I said, I think I've definitely seen changes. I think it's worth a try. We've got nothing to lose.
Right.
And of course, the parents were a little like any parent, you're touching their kid and what's going to happen. But it was so obvious to me that there was a problem in that, what we call the atlas or the upper cervical, that it was clear that something was wrong. So I made very, very gentle adjustments to her. And with time, they were noticing, oh, wow, she's not crying because of her ears. Like, she hasn't had an ear infection since she's been coming in to see you. And it was to a point where she had failed a hearing test because all the chronic damage to the ear. And so that came back. She was no longer having to be on, antibiotics her whole life. So it was something where you think and go, wow, if that grandfather hadn't said to his son,
right,
maybe you should try this. Who knows? She could have had permanent hearing loss because of something as simple as just fluid not draining properly.
It's amazing. I mean, I've obviously been very aware of it for the treatment of my clients with car accidents and things like that.
Yes.
But it's interesting to keep that in the forefront for other things that might not be as apparent.
Right.
So if somebody wants to get a hold of you, they're interested in starting chiropractic care, what's the best way for them to do that?
Absolutely, you can reach out to my office, and that number is 978-984-6636. The practice is called Methuen Chiropractic Associates. We're right across from the Loop and the 100 Milk Street building. We've plenty of parking. We have a beautiful space. This is a new space for us. We're going into our 6th month, and very excited for this new adventure. Patients have been really happy with just how the place feels, the welcoming. We do our best to treat everyone, no matter what, the same. Like I don't get involved with the insurance part. I'm behind the scenes doing my thing. It doesn't matter to me what someone has. They're a person and they're looking for help from me, and that's how they're going to be treated.
Right. I definitely appreciate you coming in today.
Thank you for having me.
This was very educational. It's opened my eyes to some things that I certainly wasn't aware of, being very familiar with your industry. And I think this is going to be good for somebody that really is trying to learn a little bit more about your industry.
Excellent. Well, thank you for having me.
Thank you for joining.